A very warm greetings to all. My topic today is Metachronous Mystery. I'm going to present a paper of a case report regarding metachronous tumors, which are lesions which reoccur at the same site after a period of 6 months once a resective surgery is done. And this case report is about a metachronous neurovascular lesion in a 3-year-old child. Coming to the case report, a 3-year-old female came with a chief complaint of mild pain in relation to the lower back tooth region and inability to open the mouth for the past 3 months. A history of presenting illness given by the patient's parents, who first noticed a gradual decrease in mouth opening and associated mild pain in relation to the left lower back tooth region. Past dental, medical, and family history did not contribute much to the present condition. An extraoral examination revealed a mild swelling in relation to the left side of the face and restricted mouth opening as seen in those pictures. And intraorally, a swelling of size 1.5 into 1 cm in relation to the left posterior aspect of the mandible extending superior inferiorly from 7-5 region to the angle of mandible and anterior posteriorly extending from the mesial aspect of 7-5 to the ramus of mandible. On palpation, the swelling was tender and hard in consistency. An orthopantomogram and a computer tomogram taken as a part of investigations revealed an irregular lighting expansile lesion with soft tissue component measuring 1.8 into 1 cm involving the ramus and the angle of mandible, with which a differential diagnosis of dentigerous cyst and eosinophilic granuloma was made. An excisional biopsy was performed for the patient under general anesthesia. And these are the intra operative pictures taken during the surgery. The histopathological section of the specimen taken during the excisional biopsy showed tumor areas composed of elongated spindle-shaped cells with wavy nuclei distributed in the form of interlacing bundles. A few areas of storiform appearance of bundles were also seen, thereby concluding the diagnosis of neurofibroma. These are the postoperative pictures taken after the surgery, and this is a postoperative orthopantomogram. Now, after 6 months, the patient came with the same complaint of restricted mouth opening with a similar intraoral swelling at the left lower posterior teeth region. The two pictures above are the pre and post-op OPGs taken before, and the OPG below shows the metachronous lesion which arose 6 months later. The metachronous lesion arose exactly at the same location of the previous one, and these are the computer tomographic images of the new lesion. A true gut biopsy was taken and it showed the presence of vimentin, thereby confirming the diagnosis of Leiomyoma. A left hemimandibulectomy was performed under general anesthesia. These are the pictures of the surgical site, and this is the excised left mandible. These are the post-op pictures and the computer tomogram of the patient 6 months later after hemimandibulectomy was performed. Coming to the review of literature, we have literatures showing metachronous transformations of odontogenic keratocysts and dentigerous cysts, and the transformation of neurofibroma into a metachronous lesion is rarest among the rare. Neurofibroma is a benign, autosomal dominant and peripheral nerve sheath tumor. They show diffuse, plexiform and localized growth patterns. The localized pattern is associated with solitary neurofibromas, whereas the diffuse and the plexiform types are associated with neurofibromatosis type 1. The solitary neurofibromas usually occur during the second and third decade of life, equally affecting males and females. They are very rare in the oral cavity and comprises only 6.5% of reported cases of intraoral solitary neurofibromas. The diagnosis of a solitary lesion becomes difficult in patients who do not have any family history of neurofibroma. The treatment is a surgical resection of tumor and has excellent prognosis with extremely rare malignant transformations, which is only commonly more seen in neurofibromatosis. A periodic follow-up is necessary in solitary tumors to rule out syndromic cases. Coming to leiomyoma, it was first reported by Blanc in 1884. Leiomyoma is a benign tumor of smooth muscle origin which is usually diagnosed in gastrointestinal tracts, uterus, and skin. It shows its predilection in the posterior portion of tongue, lips, palate, gingiva, and salivary glands. Intraosseous oral leiomyomas are rare, and those of mandible are very rare. Clinically, they can be seen at any age ranging from infancy to 76 years, but mostly seen in middle-aged groups and exhibits male predilection. Radiologically, angioleiomyomas manifest as unilocular or multilocular radiolucent lesions with either an ill-defined or a well-defined sclerotic border. Cortical expansion of alveolar plates may be evident and root resorption may also be seen. Histopathologically, it composes of spindle-shaped cells arranged in a rolled interlaced fascicular pattern. The cells elongated nuclei with fusiform or blunt ends. The line of treatment is a conservative surgical excision of the tumor. Conclusion: leiomyoma in the oral cavity is a rare and is still a rarer entity in the mandible due to the paucity of the smooth muscles. It should be considered in the clinical differential diagnosis in pediatric patients due to its wide presentations in different age groups. Even though the present case, the clinico-radiographic and the histologic findings favored a benign process, this case of metachronous neurofibroma and vascular angioleiomyoma is a keen reminder for which attention should be paid on the clinical and radiological follow-up of these tumors, and one must be aware of the possible recurrences of neurovascular malignant lesions. Thank you.